Health Minister Dr. Christopher Tufton says the first field hospital will be erected in the coming hours in hurricane-torn St. Elizabeth. He provided the update at a media briefing today.
Several of the island's major hospitals are still reeling from the impact of Hurricane Melissa, which struck on Tuesday. The Savannah Lamar, Noel Holmes, Black River, Cornwall Regional and Falmouth hospitals were among the main public health facilities affected by the storm. Health Minister Dr. Christopher Tufton says a number of patients have been displaced since the catastrophe. He notes that some of them will be transferred to the Mandeville Regional and St. Anne's Bay hospitals for continued care.
In the case of Mandeville patients from St. Elizabeth, we've had to relocate patients out of Black River, and so they've had to take the additional capacity. In the case of St. Anne's Bay, where I visited, they are seeing maybe 60% more patients in A&E because persons are coming out of Trelawney and even as far as St. James to access health services.
However, Dr. Tufton says Black River will receive a field hospital as early as tomorrow to help ease the pressure.
Immediately we'll begin to deploy and to set up that facility. That facility will come fully equipped, which will include an operating theater and other critical diagnostic equipment and some team members to support the local team. And therefore we're hoping that during the course of this week, St. Elizabeth, the parish, and Black River, the capital, will have a functional hospital, which is a field hospital, while we assess what is happening at the original hospital.
Dr. Tufton adds that additional field hospitals will be established in other affected areas in the coming days.
We have a field hospital that is coming in from Spain and the Spanish government, and we are now doing an assessment at Sablamar and Falmouth, looking at where is best suited to locate that facility. Similarly, so there are discussions with the Canadian government and the Indian government, and we are working on the assumption that we will see another 2, possibly 3 field hospitals.
Prince Moore, TVJ News.
Meanwhile, Dr. Tufton says health workers who were not badly impacted by Hurricane Melissa will be out tomorrow at the 5 affected facilities to assist with cleanup operations.
So we have about 200 or so health staff. We're working with health staff in the first instance. We know there are others who want to volunteer. We'll be leaving Kingston early morning, I think 6 a.m., supported by the JUTC. And we will be visiting maybe a team at Black River, primarily focused on the field hospital setup, JDF-led team. We'll be going to Falmouth, Noel Holmes, Cornwall Regional, and SAV. A team of at least 30 or 40 per location. They'll be going in, helping to clean up on the compound of the hospitals, giving support to the local team, maybe some welfare support, working with the Ministry of Labor,